A lot of people have asked me, why don't you show the full treatment process? Some even said that short clips just leave them wondering what happens next. So this time, no cuts. This is a complete treatment video, start to finish, one of the most common and painful cases I deal with here. Maggot infestation in ears. And yes, it's a full 5 minutes video, so if you ever wonder to see how we handle a case like this, I hope you will watch till end. I got a call from a dog's owner, a German Shepherd around 4 to 5 years old. He had been shaking his head for days, scratching at his ear, and the smell has become unbearable. The moment I got there and examined him, I already had a suspicion. And when I look at clear inside the ear, maggots deep inside, burrowed in the moist, infected tissue. It's not something you want to ignore. For a case like this, sedation is non-negotiable. The dog is in pain, the area is sensitive, and the procedure requires time and precision. So I sedated him gently at home, monitoring him carefully. Once he is asleep, I cleaned the outer ear with antiseptic solution. There was necrotic tissue, visible maggots movement right at the entry site. It's one thing to see this on camera, but the smell and the heat from the wound, you know this dog has been suffering. Now the removal begins, one by one. I extracted the maggots using sterile forceps. Some are small, early stage larvae, others are large, fat, and deeply embedded. They burrow under the layer of dead skin, feeding on live tissue. They love warmth and moisture, and the infected ear like this becomes a perfect hiding spot. This part takes most time. You can't rush it. You remove the obvious one first, then you search through folds under debris and wipe constantly to check for more. We use specialized medications which we apply there so that cause irritation to the maggots and they start loosening up and we can find them like this and we keep removing them. I always go over the same spot twice. Why? Because missing even one means the problem comes back. By now you can see the wounds opening up, the swelling is going down and the maggots are fewer and slower. Once I was confident enough that all the visible maggots were gone, I started treating and cleaning the wound. First I applied the antibiotic spray. This helps kill bacteria and prevent infection. Then I followed it with the aluminum wound spray, also known as Aluspray. It creates a protective film over the tissue, keeping it dry and shielded as it heals. And these sprays will be applied on the ear twice a day for next 3 weeks, because the maggot infestation like that requires minimum 3 to 4 weeks to completely heal. And during that we give them medication which don't allow more maggots to survive in the wound. So even if somehow they are exposed to flies or larvae eggs, they will not hatch and the wound will be protected. Of course, external cleaning is not enough, so I gave him subcutaneous injection of Ivermectin. This helps to kill any remaining larvae under the skin. In some cases, they have burrowed deep, but then what we can see, so the medication will kill them. Then I followed up with the supportive injections and antibiotic to fight systemic infections, and anti-inflammatory to bring down swelling and pain and irritation, and vitamins to boost healing. The treatment ends here. The recovery continues at home. The stock will need monitoring over the next few days. With the infestation clear and medication on board, is already on the path of recovery. If you are still watching, thank you so much. These are not glamorous procedures, but they are real and they matter. This is what field veterinary works look like. If you found this helpful or meaningful, please consider subscribing, liking or sharing with others, and I'll keep bringing you more full treatments, unfiltered and real. Please, I really appreciate your feedback. It's a negative or a positive comment. I always try to get better and better. Thank you so much.